and we're focused on the commitment to the nursing profession and veterans healthcare with over 1,200 scholars funded to date. Please be sure to follow us on our Facebook and LinkedIn pages at Jonas Philanthropies and on Twitter at Jonas Impact and on our website at www.jonasphilanthropies.org. You can also check out our website, visit our media library of recordings, and our upcoming events. As I previously stated, this webinar is being recorded, so it will be posted in our media library. As a reminder, please be sure to mute yourself, and if you have questions, please use the chat function to submit your questions. The Jonas staff will monitor and help moderate the questions throughout the session. Today's webinar is entitled Pregnancy, Hypertension Risk, and Air Pollution. And we would also like to acknowledge Columbia University School of Nursing Continuing Nursing Education Program. This webinar will be eligible for continuing nursing education credits. So if you would like to obtain credit for the webinar, please click the link below. Today's webinar is entitled Pregnancy, Hypertension Risk, and Pollution by our Dr. Brandy Beverly, who's a health scientist at the Office of Health Assessment and Translation and the National Institute of Environmental Health Sciences National Toxicology Program. We thank you, Dr. Beverly, for taking the time out today to present this webinar for us, and I'll turn it over to you now.
Great. Thank you so much, Althea, and thank you to all the organizers for putting this together and giving me an opportunity to have a conversation with you all and talk a little bit about the work that we do here at the National Toxicology Program. Next slide, please. So just to give you an idea of what we're going to talk about today, I'm going to give you a little bit of a background on the National Toxicology Program and then introduce some of the basic elements of systematic review that we use for environmental health, and then how we applied that for this evaluation that we most recently completed on traffic-related air pollution and hypertensive disorders of pregnancy. And then I'm going to finish up with a couple of slides on what we're looking at doing for next steps, some of our research needs, and some helpful resources for you that we can start to look at to start communicating environmental health. And hopefully this will start a dialogue on how we can better improve that communication between the researchers and clinicians. Next slide, please. So the National Toxicology Program is an interagency program that was established in 1978. It consists of scientists from the NIH, particularly from the National Institutes of Environmental Health Sciences, members of the CDC, as well as the FDA. And we are headquartered at the National Institute for Environmental Health Sciences here in North Carolina. There's two major components to the National Toxicology Program. There's this testing program where we have thousands of agents that have been evaluated, as well as an analysis portion that really focuses on looking at literature-based evaluations to reach hazard conclusions. And I am part of the Office of Health Assessment and Translation. And if, next slide, please. And the work that we do at the Office of Health Assessment and Translation, we serve as an environmental health resource for both the public and for regulatory agencies. And we do this by conducting literature-based evaluations to assess the evidence that exposure to environmental chemicals are associated with adverse health outcomes. In addition to, and we communicate that information through our NTP monographs, and I'll talk about the most recent one on hypertension and pregnancy shortly. In addition to the work that we do, you can go back one more time.
Sorry.
No worries, you're fine. In addition to the evaluations that we conduct, we're also heavily involved in systematic review methods, development, and uptake within the environmental health community. And we are actively engaged in efforts that encourage harmonization, as well as engaging in collaboration for some of these ongoing challenges that we're facing. And I think we can all appreciate at this point, you know, some of the things that we are working on actively with World Health Organization and other organizations around the world, looking at how we can better evaluate studies and work on rapid guideline development to address public health emergencies. Next slide, please.
Okay, sorry.
Nope, you're
We're
fine.
having this challenge again. Give me 1 second.
Thank you.
Mm-hmm.
So what is systematic review and why do we use it? And I'm sure if you are familiar with systematic review, this will be a review for you. But you know, and because it does have its origins in the clinical medicine field, many of you might already be familiar with it. But it's a predefined multi-step process that we use to identify, select, critically assess, and synthesize data from published studies to answer a specific research question. It has explicit systematic methods. We do this in order to minimize bias, to have more reliable findings, and reach more transparency in reaching our conclusions. And it's also very helpful then in informing our decision-making process. And as I said, it has its origins in clinical medicine, and the National Toxicology Program has been one of the leading groups that has made the adaptation of systematic review for environmental health. Next slide, please. So our approach has been used by several environmental health groups, and the approach is called the OHAD approach for systematic review and evidence integration. And in addition to our systematic review process, we also outline how we integrate evidence, and that is a process for developing hazard conclusions by integrating evidence from the human and animal evidence, and we also incorporate support from mechanistic data.
Oh, she goes. What happened? We don't hear her. Okay. Are you still there, Brandy? Unmute.
This happened just now. Sorry about that.
Okay, there you are. All
Okay,
right.
sorry. You can advance to the next slide, please.
Okay. Sorry about that. Not sure
All
what
right,
happened.
so one of the challenges, no, you're fine. We are in this together, so I completely understand. So one of the challenges that we have in the environmental health field, in particular when it comes to integration of evidence, is that a lot of the data that we use to address questions for environmental health, they can come from really large and diverse, complex data sets. And so you can imagine a body of evidence that we would use to make a decision could consist of experimental animal studies, as well as human studies with a variety.
Oh no. Oh goodness. Sandy, I think you keep freezing. Oh goodness. All right, everyone, please just give us a minute here. We thank you for your patience. Okay.
Sorry.
Unmute.
No, it might be me.
Okay.
I'm sorry. Please?
Yes, we hear you now. Okay.
Okay, great.
Okay.
You can
Okay, now. All right, hold on 1 second.
Okay.
Okay. All right, there we go.
Great. So our approach can really fall under 4 big steps. So the problem formulation and protocol development, where we outline what our research question is going to be, as well as outlining how we're going to move forward with the assessment. Identification of the evidence an evaluation of that evidence, looking at the study quality, and then finally putting all the pieces of information from our human evidence and our animal evidence in mechanistic data to reach conclusions. Next slide, please. All right, so the most important step in this process is the problem formulation process. And this process is our systematic approach that identifies all of the factors that are critical to conducting review to address a specific research question. And so the problem formulation efforts consider things like the purpose of the evaluation, the scope, the depth of analysis needed to reach conclusions, the approach that you're going to use depending on the type of data you have, as well as things like available resources and the feasibility of producing a document in the amount of time necessary to make those decisions. And so this is all done a priori, and you can see, you know, I have my little comic here, and you can see that they're, you know, you've gone through the process of writing a paper, and then the last thing you need to do is find a topic. And that is not what we do in systematic review. Can you advance, please? So we encourage, you know, people to really work and think about some of the challenges and what you're planning on doing prior to conducting the review, and really outlining what you're going to do in the protocol development. Because if you write a good protocol and that's critically reviewed, if you follow that, then you're more likely to have a successful review. Next slide, please. So we typically develop our research question in the context of a PICO statement. So those of you who are familiar with the systematic review process for clinical medicine are familiar with PICO, P-I-C-O. Here we're looking at the population, exposure, which is where we differ from the clinical medicine, which looks at the intervention. The C is comparator and outcome of interest. Can you advance one, please? So in the context of the study that I'll be talking about today, we're interested in traffic-related air pollution. So we can develop a PICO statement that says, does exposure to higher levels of traffic-related air pollution induce hypertension during pregnancy in pregnant women compared to pregnant women exposed to lower levels? And so in this case, our population is pregnant women. Our exposure is traffic-related air pollution. We're comparing women with lower levels to those with higher levels of exposure, and our outcome of interest is hypertension during pregnancy. And this, when we frame our question, that really informs the research that we're going to do. And as I mentioned before, developing the protocol is really important, and you can actually have that protocol published before conducting the review, which we prefer, to allow you to have some kind of critical feedback on the approach to make sure that you have the highest probability of success moving forward with your systematic review. And there's several resources, websites that are available that will allow you to publish your protocols. Next slide. All right, so the next step is identifying the relevant evidence, and that usually involves a lot of back and forth with librarians trained in systematic review, so that you can develop a very comprehensive literature search strategy that allows you to obtain the relevant results. And then we extract that available data. Next slide. And then the next step is, oh, we can go back one more. Sorry. And the next thing that we do after we identify the relevant evidence is actually evaluating, and we assess individual study quality or risk of bias. Next slide, please. So risk of bias is also known as internal validity, and it asks the question, are there aspects of the study design or reporting that would introduce bias into the results? Next slide. So there's a really nice example here that I would just quickly share with you. So this is a study that was done with maize bright and maize dull rats. And so student researchers were given two groups of rats. They were maize bright and maize dull. And they were told that these rats were selectively bred according to their ability to perform this T-maze. And the T-maze is illustrated here, where you have this T-shaped area where the rat would either go to a light area or a dark area, and the dark area was associated with the treat. And so it's just a test to see how quickly they can make the connection between the dark side being associated with a treat. And they were told, the students were told that these rats, then rats that performed well were bred together to create these maze-bright rats, and those who did not perform well in this test were bred together to create these maze-dull rats. And so they were given these two groups of rats, and they were told to perform this T-maze, and then they recorded the results. Can you advance one, please? One more time. Great. So what they found was that the animals that were from the maze-bright group were able to correctly find the dark side more times per day than the maze-dull rats, and they were also able to take less time to make a correct response compared to the maze-dull rats. And so you can see in this study, there were some statistically significant differences between the maze-bright and maze-dull rats. Next slide. However, and you can advance one, there was actually no difference between these rat groups. These were all rats from, regular laboratory rats that were randomly assigned to the two groups. But because they were told that one group was maze-bright and one group was maze-dull, there was some implicit bias in how they conducted their studies. And so it really just shows that when you know what you're supposed to find, you will find it. And what we want to do when we're thinking about bias, especially when we're thinking about conducting evaluations that are needed for decision making, we really have to be aware of any type of bias that might be affecting our results. Next slide. So there's different types of bias. There's selection bias, performance, detection, and attrition bias. And each of these types of bias can affect our relationship with the truth, right? So in all of the work that we do, we are trying to better understand the relationship between some outcome that we're looking at in our exposure. And so we're trying to figure out how close we are to the truth. And some of these areas of bias can influence that relationship. And so we want to be aware of that. And so we have developed a risk of bias tool to look at this internal validity. And we say, we have different questions that really speak to the different types of bias. And we can represent that visually in this heat map, where we have our different questions of interest as well as studies, individual studies. And you can see as you move across, you can see the different studies and how how they rated for those different questions. Where definitely low risk of bias is where we want to see for all of the studies, which is represented by the dark green, double plus signs, and then there's probably low risk of bias, which is the lighter green. And then we have, we get into the areas where we think that there might be some concerns with our yellow and our red for probably high and definitely high risk of bias, respectively. Next slide. So after we've assessed the individual study quality or internal validity, we then need to figure out how we put all that information together in order to reach conclusions. Next slide. So there's many different forms of evidence integration, and they go from, expert guided judgment to more structured qualitative approaches and even quantitative approaches. And you can advance one, please. The Office of Health Assessment and Translation's approach for systematic review and evidence integration falls under the structured qualitative form of evidence integration, but these are not mutually exclusive. And again, it is fit for purpose. So depending on the type of data you have and what you need in order to make decisions, you may incorporate quantitative approaches or expert guided judgment in order to reach your conclusions. Next slide. So one of the things about systematic review that we can appreciate, especially when it comes to decision making, is that it's really effective at transparently evaluating evidence on groups of studies that address either the same or similar endpoints. And so, but a lot of times the work that we do, especially in environmental health, we have really broad topics. So is PM 2.5 associated with cardiovascular toxicity is a really broad question. And so in order to address that, we can start to list a series of more specific questions. And so in this illustration, you can see all of the cardiovascular endpoints are represented by this bowl of fruit. Our cardiovascular endpoints that are associated with PM 2.5 exposure are represented by this bowl of fruit, and you can break that down into specific groups and then evaluate those groups in order to reach conclusions. Next slide. So after we've grouped our studies, and we do it separately for the human evidence and the animal evidence, we have to rate the confidence in that body of evidence. And confidence is a measure of how confident you are that the findings from a group of studies actually represent that true relationship between the exposure and the outcome that you're interested in. And so we do this in 2 steps typically. The first step is really setting your initial confidence, and that's based on study design features. And so for the 4 features that we're interested in is whether or not there's a controlled exposure, whether the exposure occurred prior to the outcome, if there's individual outcome data, and if there's a comparison group used. So depending on how many of those features are present in a particular study design will determine its initial confidence. And the confidence levels are high, moderate, low, and very low. After we've done that, then we consider factors that would either increase or decrease our confidence. And so you can imagine if there's a large magnitude of effect or evidence of a dose response, that would increase your confidence that the relationship between the exposure and the outcome is really reflected in those studies. Conversely, if there's unexplained inconsistency or the risk of bias concerns, that would decrease your confidence. Next slide, please. So for our framework, after we've developed our confidence ratings, we need to translate that into levels of evidence. And it's a very simple conversion. It really considers just the confidence rating and the direction of the effect. It's a one-to-one, so a direct relationship. So if it's high confidence, you have a high level of evidence and so forth. Next slide, please. So finally, we're able to develop our hazard conclusions. And again, this is done in 2 steps. Our initial hazard conclusions are reached by looking at the level of evidence for both the human evidence and the animal. Our hazard conclusions are on a 4-tiered scale. Again, it's known, presumed, suspected, and not classifiable. And essentially you look at the schematic and you can see that the animal studies are on the x-axis and the human studies are on the y-axis, and where the 2, depending on the level of evidence for each of those, where they meet is where you have your initial confidence. And then we consider the impact of any relevant mechanistic data to either increase or decrease our confidence or keep it the same. Next slide, please. So this is a nice place to stop and just talk about some of the things that we've already discussed. And so we have a couple of poll questions just to help strengthen your knowledge. And I'll give you a minute or so to read through and select what you think is the correct answer. And then you can submit.
Okay. So I think Maggie is going to pull those up for everyone. Because we're still just waiting to see. Okay, there we go. There it goes.
Great. So are we able to see how everyone did?
Let's see. Hold on. Okay, what we'd like everyone to do, I believe, when the poll question pops up, is respond. You may see a link that says poll in progress if you're on your phone, and you'll see the question that has popped up. And you can select a response. Okay. All right. I think everyone is responding. I think we're getting a few responses.
Oh, great.
So.
All right. So we could probably. Oh.
Okay. Yeah. There
Yay. Oh, great. This is great. And I'm enjoying that we have this option. Awesome. So great. Yes, we have a nice majority of the people selected the correct answer. So great. So next slide, please.
Okay.
So yes, environmental health research questions are developed in the context of a PECO, P-E-C-O, which stands for Population, Exposure, Comparator, and Outcome. And then the reporting of aspects of study design and reporting for individual studies that could introduce bias in the results are known as risk of bias or internal validity. So great, thank you so much for participating. Next slide. So what we want to do now is shift gears and talk about systematic review and how we applied that to one of the assessments that we did. So we received a nomination to it was actually from pediatricians from the American Academy of Pediatrics, and they were interested in reaching out to us to evaluate some emerging children's health issues associated with ambient air pollution. So as I mentioned, as you can imagine, all of the health issues and associated with ambient air pollution really represents a broad topic. And part of our problem formulation efforts were really focused on identifying exactly what we needed to do and what we need to focus on. And that really required a back and forth with our stakeholders, so with the pediatricians, as well as other subject matter experts, in order to really identify an exposure and an outcome that we should move forward with a full systematic review. So based on those efforts, we identified hypertensive disorders of pregnancy as an emerging air pollution related health issue affecting both mother and child. And we also we found through some of our scoping efforts that exposure to traffic related air pollution was also potentially associated with hypertensive disorders of pregnancy. Next slide, please. So of particular relevance to the nominators, children who are born to mothers who experience hypertension during pregnancy are at higher risk for some short and long-term effects. So, even in utero, in growth restriction, when they're born, they're at higher risk of being born with a low birth weight or being born premature, and that is also associated with, related neonatal diseases. And even as an adult, so children who are born to hypertensive mothers are at a higher risk of developing cardiovascular disease later in life. And so when we think about children's health, we may not necessarily, I think the lay public may not necessarily make that connection immediately to studying hypertension in the mother, but it really does have long-term implications for the offspring. And so we thought that this was a very important topic to discuss and to evaluate, so that we can start thinking about decision-making and how we can better communicate those results. Next slide, please. So what do we know about hypertension in pregnancy? It's really interesting when you look at the data. There's a lot of research that's been focused on hypertensive disorders, but there's still so much that we don't know. And we know, though, that the known risk factors, so comorbidities, your age, being over the age of 40, or having multifetal gestation, will increase your risk of developing, can increase your risk for developing hypertension during pregnancy. But those known risk factors really only explain a fraction of the cases. And most women who develop hypertension during pregnancy do so in their first pregnancies, and they don't have any other known risk factors. So the question is, are environmental exposures potentially contributing to the development of hypertensive disorders of pregnancy? And that's really where we wanted to focus. Next slide, please. The other issue that we had when we were thinking about doing this evaluation for air was, thinking about air pollution. And we typically, when we conduct our systematic reviews, they're typically done on single chemicals. And traffic-related air pollution, it refers to, the pollution exposures that are derived from primary emissions from motor vehicles due to fossil fuel combustion. And they can come from passenger cars, diesel trucks and buses, as well as non-road equipment, such as lawn equipment. And it includes a variety of pollutants, such as carbon dioxide, carbon monoxide, nitrogen oxides, sulfur oxides, particulate matter, diesel exhaust. So there's this very complex mixture that we're thinking about, and we have to figure out how we can evaluate that in order to reach conclusions. Next slide, please. So we worked with our team, and we were able to conduct a comprehensive literature search looking at studies that would allow us to address that question of hypertension during pregnancy associated with exposure to traffic-related air pollution. And so we were able to, after conducting our comprehensive literature search, we identified 344 unique references that then underwent a series of screenings. And we ended up using 19 studies for this evaluation, 18 human studies and 1 animal study. We were able to look at different outcomes associated with our question, which included preeclampsia, gestational hypertension, blood pressure changes during pregnancy, as well as like a combined hypertensive disorders of pregnancy. And then there were also the exposures that we were we looked at fell under the categories of particulate matter, nitrogen oxides, carbon monoxide, black carbon, and then we also had studies that looked at direct traffic measures such as traffic density and proximity to main road. Next slide, please. And so we went through our systematic review process. So we evaluated the individual studies. We assessed risk of bias, and I showed you that larger heat map that showed that we really didn't have too many concerns for risk of bias, so that was good. Next slide. But then we had to think about how we would put all of this information together in order to reach conclusions. And so we saw that the majority of the studies fell under, 3 main exposures. And those were PM2.5, nitrogen oxides, which was mainly driven by nitrogen dioxide, as well as the direct traffic measures. And so the other exposures that were identified really weren't that many, and there was insufficient evidence for us to really reach conclusions. And so we talked about those, but then they were moved on to in another section. We didn't use that to reach our conclusions. And then we developed our confidence ratings for the different components. Next slide, please. And so when we look at the individual combined exposures for traffic-related air pollution, we identified, for the majority of the studies that looked at the traffic air pollutants, we had a moderate confidence rating. And then for our direct traffic measures, looking at studies that looked at hypertension during pregnancy and then traffic density or proximity to main road, we started off with a moderate confidence, but because those exposures are much more are much cruder exposure or measurements or characterization of the exposure, we downgraded it for imprecision. So they ended up having a low final confidence rating. But taken together, when we look at the combined exposure and the combined body of literature, we reached a moderate rating. Next slide. And so given that information, we then moved to reach our hazard conclusions. And so we looked at the level of evidence for our human and our animal studies. And again, we had 1 animal study, but that animal study actually looked at an exposure that didn't have a very large number of studies, so we weren't able to reach conclusions for that particular exposure. So the confidence or the final hazard conclusions are really based on the epidemiological data, the human evidence. And so based on that, you can click one more time. We reached a presumed hazard conclusion for this, and you can advance to the next slide. And so what we found then was that exposure to traffic-related air pollution was presumed to be a hazard to pregnant women, and that was based on the collective evidence that outlined that exposure to components of TRAP were associated with an increased odds for developing hypertensive disorders of pregnancy. Our conclusions were based on only the human data, and I already talked about the single animal study that was evaluated. But what this shows, though, is that we're thinking about some of the risk factors, and it seems like the environment might be playing a role in some of the cases of hypertension during pregnancy. Next slide. So our document was released in December of 2019, and there are a lot of things. We had some limitations to the systematic review, but I think the big issue or big area where we would like to focus on are some of the limitations to the evidence base. So for the systematic review, we limited it to just air pollution exposures that can be attributed to traffic. And that was intentional because we wanted to be able to look at that. But the reality is that it's very difficult to really attribute for certainty that all of these exposures were due to a traffic-related source. However, with the kinds of studies that looked at it, mostly modeled data, I think they're better able to characterize the exposure. And so we were able to limit some of that uncertainty based on the study designs that were included in the evaluation. We also limited the evaluation to primary emissions. There's some evidence in the literature that looks at ozone, and we know that that can lead to adverse health effects, but those were just not included in this particular evaluation. But for the evidence base, and this is really an area where we want to start communicating with people who are conducting these types of studies, is that, you know, there's things about study design that I think that we can start thinking about incorporating into studies for those who are interested in designing studies, where we start to think about incorporating environmental health parameters in there, such as, you know, how can we start thinking about personal exposure data, for example. You know, we are assuming, or we're predicting exposure based on the on exposure in the air, or levels measured in the air and predicted by, you know, different monitoring stations and then modeled, but we really don't have that personal exposure data. And I think there's some ways that you can easily incorporate some of these in studies, determine a person's exposure, and hopefully, ultimately, we think that that can be helpful in really personalizing someone's care, depending on how much, you know, their exposure is, and really thinking about how to offer effective measures to reduce their exposure if they're at high risk. We also had some issues with no animal data, and we didn't have a lot of studies that look at mechanism, and that was really another issue, where there's lots of studies that look at the mechanisms behind hypertension during pregnancy, but they really don't look at that in the context of environmental exposures. And so what impact do environmental exposures have on some of those mechanisms and biomarkers? Next slide, please. So this brings us to our second question, our second set of questions. And if you all are game for another round of this, I'd love for you to answer questions and push submit when you're finished.
Okay, good. So you see there's one question: hypertensive disorders of pregnancy were evaluated primarily due to their, and there are some choices there. So hopefully everyone just pick a choice there. And the next question is, what information could strengthen overall findings? And then there are some other choices there. So hopefully we have a few responses. Let's see what the results were this time. Okay. Great.
Good. This is, y'all are great. I appreciate this. Okay. So yes, we are all around on the same page. You can advance one slide, please. So yes, this particular evaluation began as because of the potential impact on children's health. And, you know, we look to the researchers who are actually conducting these studies and designing these studies, think about, you know, what can we do to strengthen our findings? And we could use information like more animal studies that are looking at impact of exposure, mechanistic studies, and that doesn't necessarily have to be, you know, if there's some molecular epidemiological studies that can also fall into getting us closer to understanding the mechanisms by which some of these environmental exposures might be affecting blood pressure parameters during pregnancy. That would be great. And again, I can't stress enough how much I would love to see personal monitoring data included in you know, someone's care. And so those are two areas, those are like the big areas that we would really like to see in studies moving forward. Next slide, please. So I've already shown you the slide, but what I wanted to just highlight again was that, we didn't have a full evidence base that would allow us to kind of understand the impact of certain mechanisms or biomarkers and the impact of the environmental exposures on those parameters. And that would have really strengthened our conclusions. But we did find that there was an association. So we do know that air pollution is playing a role in, or is associated with the development or exacerbation of hypertension during pregnancy. But the question is, are there others? So advance one, please. So are there other environmental exposures that we should be concerned with? And that's really where we are with the next steps. And I'm hoping, I just have a few slides left, but I'm wanting this to kind of be the segue to have more discussion about how we can better align some of these questions about environmental health into patient care. Next slide, please. So one of the things that we've set to do is really look at the impact of environmental exposures on some of these mechanisms that are thought to be involved in hypertension during pregnancy. And we know that there's some challenges to doing that because some of those early mechanisms and biomarkers just aren't very well understood at this point. So we do know that, there's kind of two stages to the development of preeclampsia and other hypertensive disorders of pregnancy. And the first one is this improper remodeling of the spiral arteries. And as you all are probably very aware, spiral arteries undergo a series of invasion and migration events in order to be remodeled from these low capacity, high resistance vessels to these high capacity, low resistance vessels. And if that's not done properly, we have this kind of, you have a situation where the spiral arteries really aren't able to deliver oxygen and nutrients to the placenta, and it becomes even more hypoxic than it normally is. And that then results in a series of effects that we know as kind of the clinical manifestation of the disease that involves, hypertension, proteinuria, and HELLP syndrome, et cetera. So what we want to do is really think about, so there's a lot of stuff we do know, right? There's a lot of things that we can look at. And there's already some evidence, at least in vitro, that environmental exposures can have some effect, especially on some of these these early migration and invasion events that are really key to the proper development of the spiral arteries during pregnancy. And so if we can start thinking about how we can apply environmental exposures to some of these studies that are looking at mechanisms, I think we can really start to have a better understanding of how these environmental chemicals might be affecting the disease. Next slide, please. So in effort to do this, we are in the process of developing a scoping report, which is just a report that's going to identify what's in the literature. What do we know right now? We know there's just not a lot of data with regard to environmental exposures, but we do have a lot of information about different mechanisms and biomarkers that are involved in hypertensive disorders of pregnancy. And if we can adequately categorize that information, we can then start to develop research that really looks at the impact of environmental exposures on those mechanisms and biomarkers. And so that's what we're doing right now, and we're in the process of developing this report that will outline what has been done and where we would want to direct our next efforts to inform the future research. Next slide, please. So what this boils down to is we want to provide information that will allow clinicians, practitioners to provide their patients with information that's based in evidence. And what we find at this point is that there's really not, the discussions around the impact of environment, I think, can be strengthened and improved. And so we want to be able to provide information that can be helpful when having these discussions. And so I think two really good resources that we can look at are the Air Quality Index. So that's from airnow.gov, and it provides an information, a nice scale of the air quality for the day. And it takes something that you can look at daily. You can put in your zip code, and it will give you the air quality for the day. And just using that information in order to make decisions about how much time you spend outdoors, especially when the air quality isn't that good, I think it's very important first step to understanding how you can limit your exposure to air pollution, especially during pregnancy, especially in populations that are at a higher susceptibility of complications associated with air pollution exposures. Another really good resource is our NIEHS website. So there's a lot of information about air pollution and what you can do to reduce your exposures to both indoor and outdoor air pollution, and for everyone. And so those are some two sites that we can look at and you can recommend when for those who are seeing patients to just think when we start thinking about incorporating environmental health considerations and care. And so some things that we recommend or things that are just good practice when we think about air pollution and reducing exposures. Checking the air quality conditions each day. Limiting your outdoor activities when the air quality levels are over 50, and definitely avoiding going outside if it's over 100. Avoiding exercising your busy roads. You're using up a lot of oxygen when you're exercising, and you don't want to be breathing polluted air if you can avoid that. So and then taking advantage of green spaces. So these are all ways that easily, hopefully, easy ways that we can kind of introduce the notion of reducing air pollution exposure, so people can be a little more conscious about, what they're exposed to and how they can reduce that. Next slide. So with that, we have our final set of strengthen your knowledge questions. What can pregnant women do to limit their exposure to air pollution? And then what are some resources that can be shared with pregnant patients to educate them about environmental health?
Okay, I guess we should have a few responses by now.
Yay!
Oh. Great.
Awesome. So next slide, please. So yes, all of these things you can advise to help limit pregnant women's exposure to air pollution. So, checking those AQI levels are really important. Utilizing green spaces, avoiding exercise near busy roads, and then, the Air Now site is great. And I think that, if we can get more people to look at that and really help them make decisions of their outdoor activities based on those levels, I think that'll be a really easy way that people can limit their exposure. The NIEHS website has lots of information about air pollution and other effects of environmental exposures on health. And next slide. So with that, I just want to thank, first of all, obviously, thank you all for your attention, and thank you for Althea and everyone, Maggie, for everyone who was able to help organize this. I appreciate talk to you all, and this is from the Office of Health Assessment and Translation, as well as the group that's working on our scoping review. And next slide, I'm happy to take questions or engage in discussion.
Okay, great. Thank you so much for your presentation, Dr. Beverly. This information was very informative. I think for me, especially that air quality information, I see it on the weather all the time, but that's something I think a lot of us probably don't really think about looking at when they talk about the air quality numbers, how it really impacts us, not just, of course, during pregnancy, but just in general. So I think that information was really helpful. One of the questions that I think may be of interest would be, given our current environment, of course, unfortunately with COVID-19, especially I know in New York, everyone's wearing masks and gloves and covering your face and all of those recommendations that have come down by the different agencies. So in your research, maybe in the studies, have you found any of the literature to discuss that maybe just wearing a mask or covering your face is helpful? And if so, maybe how helpful is it to do that to reduce the risk of hypertension during pregnancy?
Yeah, that's a really good question. So I don't think that there have been a lot of efforts to kind of push, um, PPE to the average citizen, especially for, air pollution, at least in this country. I mean, I know in a lot of other places, that's not even a question with the air pollution levels really high. A lot of people are wearing masks. And I don't think that that has been adopted here as much. But I think that that's actually, it's not a bad idea. And I know with COVID-19, and there's lots of, there's a lot of evidence emerging, and it's constantly changing. But, the question was before, are women particularly at risk? And there's now starting to see studies where women, there's a higher incidence of stillborn. There's studies that are emerging that are suggesting that. And so, how can we start to think about what women should do when they're pregnant? And I think that that's, not only to deal with the environmental exposures, but now, we're dealing with the virus. I think with typical, and I'd have to look into this a little bit more, but certain fabrics just aren't conducive to actually stopping the penetration of different, depending on what the exposure is. And so some of them may not be effective to really prevent transmission. But so we have to be kind of careful about recommending things and making sure that they actually work. But for regular interactions, I think that it might be wise, especially at this day and age, to really, for pregnant women especially, to just keep their distance and wear something. And we were talking about this at work. And actually, if you have a cloth mask and you put a coffee filter underneath that, you kind of get the levels of a typical like surgical mask. You actually get the spacing between the fibers is actually pretty decent. So if you have a coffee filter and a cloth covering, it actually can work pretty well. So I don't know how well people or how much people are kind of talking about the different materials for pregnancy purposes in particular, but I think that if you need a makeshift mask, pairing the coffee filter with the cloth material, I think will allow you to go to do basic things like going to the grocery store and taking care of those necessities.
That's good to know, because I think at some point some of us were thinking about the whole thing with the coffee filters. I actually heard about that recently. Mm-hmm. And I was surprised to see that that was something that could actually help. So that's good to know.
Yeah. We were just discussing that, but you see things on the internet and various social media platforms, and they're crocheting masks, and I'm like, this is not going to do anything for you.
Right.
And so and we always encourage people to look at the CDC website, and hopefully they're updating that very regularly, and so you can get some information there, and to just go to trusted resources for your information.
Okay, great. There I am. I was trying to pull up my video so everyone could see me. And I have one more question for you. So in regards to the air pollution, one of the things that I think is interesting is this whole concept about hybrid cars and the fuel efficient cars and all of these less emissions, these cars that are supposed to be so great on gas. Have you seen anything about that maybe in the literature? Are any areas with those cars, are they actually helpful? We hear so much about them and being promoted, but are those cars actually helpful in reducing the air pollution?
And they definitely are. We just don't have as many. I mean, those who are driving those cars compared to those who are not, I think the proportion of them, it's skewed. And so we don't, they are helpful. But what I think one thing that we've learned from this pandemic with people spending a lot of time at home is that we're seeing reductions in air pollution. We're seeing it all over the world. Mm-hmm. Air pollution is being reduced, and it has a lot to do with the fact that we're not driving anymore. We're not driving as much. So, and so, I'm always, people are asking, what can an individual do to, reduce their impact on on air pollution. And it's like simple things, looking at your schedule every day and saying, okay, I don't need to go to the grocery store every day. I'm going to go to the grocery store once a week now. And if everybody does those type of activities where they're just looking at what they can do feasibly, and then, you know, taking 2 or 3 items to try to reduce the amount of time they're spending in their cars, we can have a huge impact. And you can see with, you know, places in California and overseas where, you know, they were just bombarded with, you know, horrible air quality. And now that they're being ordered to stay at home, we're seeing those levels really reduce.
Well, that's good to hear. And it makes sense. And everyone is going through this at this time. And I think it was really good that you did include those tips there for those, especially, you know, we always have some patients who may be in areas that are have more busy, more urban areas where there's more pollution, or even areas where there may be more industrial and, you know, may have more chemicals in the air there. So just to know, you know, the tips about staying away from busy roads, you know, and monitoring the air quality on certain days, you know, selecting maybe days when it's better to go out over others. I think those tips will be very helpful. And I'm sure all the information you've shared today was very helpful for us. As I mentioned, we did record the webinar, so it will be available on our website. And did you have any final tips or final thoughts to share with us today?
Well, I just want to say again, thank you so much. I think this is a really great opportunity for us. One of the things that we want to do, we do a lot of toxicology research, and it's related to human health, but I think that we are really looking now to provide better ways to communicate that to groups who are actually conducting the research, to groups who are actually interacting with patients. And so I just really appreciate the opportunity to talk to practitioners, to really start to have those conversations about how we can better communicate environmental health considerations into care, and how we can provide really feasible options and information that they can follow that will help reduce their exposures. So. And I think, you know, having more conversations like this and really bridging that communication between the practitioners and the researchers, and, you know, you all kind of serve as a hybrid, right? You are interacting with patients as you're also doing the research. And so it's
Right.
we can start thinking about how to incorporate environmental health considerations into the research that you do. I think that we'll have a really stronger opportunity to look at the impacts of environmental health and how we can start to reduce some of those health effects associated with those exposures.
Okay. That sounds really great. And I'm glad that you pointed out the whole aspect of the research that your agency has done and the work that you've done, because I think it's very important. We hear so many different things about environmental health and the different hazards that are out there, and especially in traffic and air pollution, and of course risks to pregnancy and children and things of that nature. So it's good to know that we have resources and agencies that are providing evidence-based research. So thank you again so much, Dr. Beverly, for taking the time to share this information with us today. And we really appreciate all the effort that you and your agencies and your colleagues have put in to providing this resource to us. And thank you to all of you who've joined us today for this webinar. We appreciate you taking out the time to spend with us. And we wish you all to be safe and well and happy during this time. Thank you again, and have a great day.
Great, thank you so much. Have a good one. Bye-bye.
Bye-bye.